Hello, everyone. My name is Gerin Lajoie. I am a psychiatrist practicing in Ottawa, Canada, and I also work as the Executive Vice President for Physician Health and Medical Culture at the Canadian Medical Association. It's a pleasure to be part of this year's International Conference on Physician Health, and on behalf of my colleagues, I hope that you will enjoy this presentation on uncovering the physician health and wellness landscape in Canada, a national analysis to inform a national framework. Before I begin, I wish to acknowledge that I am presenting virtually from my home in Ottawa, which is located in the unceded territory of the Algonquin Anishinaabe people. In terms of conflicts of interest, Kristen Smith, Christopher Simon, and myself are employees of the Canadian Medical Association, and this work was supported through the CMA MD Financial Scotiabank Affinity Agreement. I have also received a grant from the Matt Gainsland Foundation, matched by the Ottawa Hospital, for a physician resiliency pilot. The learning objectives for this presentation are to explain the Canadian landscape of physician health and wellness programming and services, to share key challenges and opportunities from stakeholders across Canada, and to discuss how these findings can inform future action. In 2019, with a vision to support a vibrant profession and healthy population, the Canadian Medical Association prioritized physician health and wellness as one of its two flagship issues within its enterprise strategy framework. As one of the first key initiatives, the CMA's Physician Wellness and Medical Culture team undertook a physician health and wellness national analysis to establish a national baseline and further develop this important issue. The objective of the analysis was to better understand the impact of practice and system-level reform within the Canadian healthcare landscape on our physicians' health and well-being. This initiative aimed to build a foundational understanding of the current landscape of physician health and wellness, including structures, programs, and processes, to aid in designing a concrete action plan and inform a national framework. It was also positioned to complement other CMA work, such as the 2018 National Physician Health Survey. What I wish to emphasize today is how instrumental the national analysis findings were, not only to shape many aspects of our team's work, but also to inform the development of the Canadian Medical Association's 2040 strategy. With the help of KPMG consultants, a broad stakeholder engagement approach was applied, and it included reaching out to national physician and healthcare organizations, quality improvement organizations, the Canadian Armed Forces, provincial physician associations, health authorities, regulatory authorities, as well as major Canadian hospitals, medical schools, and the patient community. During the fall of 2019, a total of 51 phone interviews were conducted and 46 information forms were collected. The interviews focused on current programs and services, success factors, challenges, potential opportunities, and on how we can advance physician health and wellness in Canada. The information collection forms were gathered through an online survey tool and focused on governance and strategy, service delivery, and information and outcomes. Secondary research was conducted from existing literature, and we also added feedback from the CMA Ambassadors Program, comprised of medical students, residents, and physicians in their first 5 years of practice, and also feedback from representatives of all the Canadian physician health programs. The Physician Health and Wellness National Analysis uncovered a landscape with gaps and opportunities, but also a set of stakeholders from across the country who were aware of the burning platform and who were eager to engage as part of the solution. So let's review the key findings. The first deliverable within this analysis was an environmental scan of the national landscape for physician health and wellness, and specifically to understand current structures, initiatives, and opportunities for improvement. The environmental scan identified 5 system-level gaps. First, in the area of national standards, measurements, and tools, there is a need for the development of a common language and definitions, key performance indicators, national standards, evidence, and research tools. Second, enhanced advocacy is needed by making physician health and wellness a priority with governments, system partners, and influences, and creating and sharing a compelling value proposition that promotes physician health and wellness as a quality and safety issue and as a health systems economics issue. Third, in the area of service awareness, availability, and access, there's a need to increase the capacity and awareness of the services that are available. Fourth, for medical profession transitions, there's a need to help physicians at specific career transition points, perhaps by adding support for well-being, life events, financial planning, practice management, or retirement planning. And finally, there's a need to shift the systems culture by addressing system and organizational challenges, by exploring and implementing frameworks such as psychological health and safety, equity and diversity in medicine, and professionalism, by addressing stigma, and by promoting physician leadership. These early findings were presented and discussed with our provincial and territorial medical associations, as well as national physician health programs in November 2019 as a starting point for this new journey to achieve impact and move the needle in the area of physician wellness. The national analysis also identified key challenges and enablers, such as the difficulty securing funding for programs, the limited resources and capacity to broaden the scale of services, the challenges of service availability due to geography, size, and specific needs in provinces, the limited data collection and reporting across the country, the lack of technology solutions in physician health and wellness, and finally, that outsourcing services to third parties required time and effort. Based on the foundation set from the environmental scan, the recommendations report identified the areas of opportunity for the CMA to improve physician health and wellness in Canada. A total of 12 recommendations were developed across the 4 key action areas that you see on the slide: national standards and measurements, awareness, availability, and access, partnerships and advocacy, and information and knowledge. Each recommendation was evaluated according to dimensions of influence, implementation timeline, urgency, and impact. To date, the recommendations have been used in 3 ways. With KPMG's guidance, the recommendations were used by the physician wellness and medical culture team to create our own strategic direction. Then, we also have been referring to the recommendations to help CMA define strategic opportunities and goals to support a healthy workforce and medical culture over the next 20 years. And just recently, we shared these national analysis gaps and areas for action with the stakeholder groups that will be benefiting from the 15 million Physician Wellness Plus affinity funding opportunity to inspire and guide them as they define their projects and initiatives. But as we were working with KPMG to finalize the national analysis recommendations in March 2020, the COVID-19 pandemic occurred. With this unprecedented strain of COVID-19 on Canada's healthcare system and on healthcare providers, the CMA decided to commission a separate report to quantify the pandemic's impact on physician health and wellness in Canada. Insights were drawn from early national and global impacts, as well as lessons learned from the 2003 SARS outbreak in Canada. This COVID-19 brief was therefore added into the national analysis work to ensure the report was relevant and reflected the urgency of the situation. Shifting to the future, how can the CMA use the information obtained in the Physician Health and Wellness National Analysis and leverage its role as a connector and a catalyst to help train and support the healthiest and most fulfilled physicians in the world? And yes, that is ambitious. Well, now we know, based on the analysis, that we can start making a difference through knowledge sharing, outreach, and engagement, by advocating for standards and best practice, by supporting increased supports and services, by encouraging the rigorous use of data, research, and quality improvement initiatives, and finally, by promoting and supporting leadership training. And that's what CMA plans to do. The national analysis, including the environmental scan, the recommendations report, and the COVID-19 brief, have uncovered a landscape primed for action, one which is equally rich in opportunities to improve physician health and wellness, and with stakeholders aware of the burning platform and ready to take action. We know that the timing is right. The convergence of increasing concerns around physician wellness, safety, and medical culture have resulted in an increasing awareness of the issue by key stakeholders and the broader public. And the unprecedented crisis of COVID-19 has demonstrated the extent to which healthcare, professionals' health and safety has been challenged. The development of CMA's 2040 strategy will build a solid foundation to influence the medical profession and culture which underpins physician health and wellness. The CMA has a unique voice, role, and capability to address these issues, to lead, to invest, and engage with others across the healthcare landscape, to have a major impact on physician health and wellness across Canada. By working together, we can truly make a difference. Thank you.